unless you've worked with it a bit. But I wanted to start my talk with that clip because it shows in such a simple and straightforward fashion the power of medical hypnosis, which reveals the incredible power of the mind for controlling what we generally think of as involuntary processes in the body. In this case, bleeding and pain. Not to mention the control of emotional reactions to such an invasive medical procedure as a hernia operation. Before surgery, during and after, John is calm, relaxed, confident, even as you could see cheerful in a low-key way. And contrast that with the experience of so many people where often our medical professionals, skilled as they may be in the procedures themselves, are often not so skilled in helping us prepare, of knowing how we can be in the driver's seat of both how the state that we enter an operation and the state we are in during that operation and afterwards. I did a training with John down in Los Angeles and quickly saw why he was chosen to teach the surgeons at the Royal Academy of Medicine. Teaching hypnosis, because hypnosis is being brought more into medical training as more and more research shows its efficacy in a lot of different applications. But why would he be chosen? Because he demystifies hypnosis. He strips away that shadowy woo-woo quality and associations that media have created about hypnosis for so many years, stretching back hundreds of years. The portrayal of the Svengalis, the idea that hypnotists are controlling the mind. It's a mind control kind of process, where it's actually the opposite, is giving people more control and more focus over how they're using their mind. Or the other side of how hypnosis is portrayed in stage musicians, particularly the kind of Vegas-style stage magicians that make people cluck like chickens and do those kinds of things in public for laughs. And although those kind of portrayals of hypnosis sell tickets and they sell books and they sell movies, they do the public a great disservice by diverting its attention from the very truths that John so humbly and convincingly demonstrated. Now, I apologize for the volume, and there were times that he was talking about what he was doing that you may not have heard, but I will be circling back to that when we're talking about this process of hypnosis. So what are these truths that the sensationalism and the shadows divert us from? One, that the phenomenon of hypnosis is real, and that's a pretty clear indication of it, because you can't cut most people open like that and take out their bodily organs without a lot of screaming unless something strong is going on. The fact that it is beneficial when applied skillfully, that it can save a significant amount of money, and that's one of the reasons it's coming to more attention in the medical establishment, because of the studies that show decreased recovery time, decreased complications from medical procedures. Often they will not entirely eliminate anesthesia, but they will use less anesthesia. And as you know, anesthesia can be have a very powerful effect on the body. You're kind of turning stuff off and hoping it's all going to come back on. And so if you can use less of these powerful medications, that's a great advantage to us as well. And it, through this of helping people work with medical conditions, work with treatments, it minimizes the wear and tear on the patients and on the staff. You could see how the doctors and nurses were delighted to have a cheery fellow going through these kind of operations rather than having to spending all their times to keep us together. And the way that it can maximize the healing process that the body just innately has. And how does that happen? Why does that happen? I hope to give some insights onto that. It's a phenomenon that is not clearly understood, because it's talking about a state of consciousness, and what state of consciousness can we adequately explain? Consciousness is a huge and a shifting kind of a topic, and it's no different when we look at hypnosis and what happens during hypnosis. But if it's been portrayed in this way, often in a kind of a dark, mysterious thing that can create either a skepticism or a fear in the public, how did that happen? How did that develop around hypnosis? So I wanted to give a very little brief kind of history of hypnosis in a healing kind of context. Now, the word hypnosis has only been around since the 1840s, but its principles have been applied in a healing context for thousands of years. Ancient tribal shamans and medicine men and women used techniques that helped their patients enter a hypnotic state. Now, John was talking about relaxing the mind. John was talking about giving suggestions that things were going to go smoothly, that this operation was the right operation with the right doctors. All these things which create this position for the mind to take, so that fear and anxiety are not pressing in and causing this kind of panic within the whole body system. So some of these techniques are as ancient as indigenous cultures back to thousands of years. There are records of hypnotic healing going back 2,500 years in China and Egypt in a more formal medical kind of setting. The ancient Greek physician Asclepios created a special sleep healing temple where the treatment regimen was very similar to modern hypnotherapy. And these practices continued throughout history by such doctors as the Persian Avicenna around 1000 AD, and much more recently the Swiss doctor Paracelsus in the 16th century, Switzerland. Dr. Franz Mesmer, who started out in Vienna, Austria, made hypnosis quite famous and very trendy in the late 1700s. He was able to create cures for a lot of cases that the other doctors were wringing their hands about. And unfortunately that created a lot of jealousy, which led to different scandals arising which were pretty much trumped up. But he, because of feeling kind of slighted by the medical establishment, he started to take on more flamboyant and even occult trappings. And that damaged the reputation of what he was doing, and eventually led to him being debunked by the medical establishment in Paris. The treatments and the documentation, the cures were so strong, and I'm talking about cures of psychosomatic illness that had no organic cause that people could find, that the doctors could find, but still were producing the same debilitating symptoms. But his cases were so impressive, they called this big committee together, and even Benjamin Franklin was sent to Paris to say, what is it that Mesmer's doing and what's behind it? And they ended up, as I said, debunking him, not because they could say his work was not successful, but because they called it unscientific. And in that context, we should point out that at the time, what were called scientific methods, the accepted medical scientific methods, were bloodletting and using leeches. And yet what Mesmer was doing, which was the strongest component, mental suggestion, was considered unscientific. So we started this big wave of a kind of a war between those doctors that were interested in the mind and the role that it played, and the doctors that were wanting to push this off the table entirely. And that has continued over the time. Freud used hypnosis until he developed his talking therapy.